And then finally, on the end, is Jeff James, the CEO of Wilmington Health, who joined Wilmington Health in 2008. Under his leadership, I'm having to speed this up so you don't applaud too fast. Under his leadership, Wilmington Health has experienced tremendous growth, tripling in size, and he's previously served other organizations as the Chief Financial Officer and the Chief Operating Officer. Thank you, Jeff, for being with us today. Why did you choose the word riveting?
Honestly, I thought about it a little bit actually on the ride over here, and I was worried about being in this spot because I knew some other people would take other words that I had in front of me, and sure enough, I had to switch my last one on the spot because growth was going to be it. Here's the thing on riveting. Like everybody in the audience here, if the last year happened to you, you could write a novel that would be a John Grisham bestseller. And so what we've seen in the last 18 months has all of the elements of that. We've had intrigue, we've had trepidation, we have had unmanageable circumstances. We have seen the best in people. We have seen the worst in people.
Absolutely.
We have seen the resiliency of organizations and community. And if that is not riveting, I don't know what is. And so it's been quite a ride. And honestly, we could have all, if this just happened in our small little ecosystem that we all participate in, every one of us could have written a bestseller that would have been riveting. And that's what I thought of on the way over.
Wilmington Health, as I understand it, is a lean organization, and Wilmington Health is thriving. Can you share some lessons you've learned that our audience can apply about the lean philosophy to their own businesses?
Yeah, thanks, Rob. You're right. With a lean philosophy, you don't keep a lot of stock on hand. And when the pandemic hit, much like many other healthcare organizations, we had supply shortages of a significant magnitude. However, some of the other philosophies are the ability to have decentralized command and control and very quick and rapid innovation. And so what we saw from our team was a very quick response from nearly all major areas of our organization to plug those supply holes. But more so than the supply challenges that we faced, it goes to this issue of innovation and rapid improvement, rapid change, being able to cut through the bureaucracy and make a difference very, very fast. So I'll give you some examples. I think in this community, we were the first to implement outdoor testing. We were the first physician group in the state to receive the vaccine from the state. We were the first organization to open up the vaccine to the entire community, not just our own patients. One of our physicians, Kevin Cannon, Dr. Cannon, was instrumental in the vaccine research for both vaccines. On a Friday, we had not a lick of telehealth in the clinic. On Monday, we were 100%. So, try fast, fail fast, try again is sort of a lean philosophy. They'd say it a little bit differently, but our ability to try things very, very quickly really helped us in this process, and just to see the resiliency of the culture of our organization and the ability to really pivot overnight, as well as just the sheer dedication of so many people. Many of you have the same stories, and I just so appreciate the work that this community has done and what our team has done to really advance what we're doing. And honestly, it follows our overall philosophy and vision statement. We have a vision statement that says, "We aspire to be the most trusted partner in healthcare. We pledge to transform the delivery system. We will continually develop collaborative and innovative solutions that demonstrate quality, reduce the cost of care, and improve the patient experience." And we live that vision every day. One of the things that this community should be extremely thankful for is the quality of the healthcare here. And I don't just mean Wilmington Health. I mean the overall quality in this community is really, really remarkable. I think some of the things, though, our philosophy and culture that are allowing us to do things different is the fact that we do follow some lean philosophies. And when we say we're focused on the cost of care, we mean it. When we say that we're focused on quality, we mean it. And this is some of the reasons why, if you look at public information, you'll see that our cost of care in the Medicare system is dramatically lower than some of our other colleagues in this community. If you look at some of the things that we're doing as far as taking accountability for the patients that we serve, then you're going to see that we're replacing the federal government and we're replacing the insurance companies as far as the risk goes. So right now, Wilmington Health, for all of our Medicare patients that are attributed to us, we're 100% at financial risk for their health care wherever they're seen. So if they come to us, we're responsible for that cost. If they go to Duke, we're responsible for that cost. And we gladly take that on because we see that as our responsibility. In another year, we'll be doing the same thing, maybe to a little bit lesser degree, but we're on a pathway to do that in all of our commercial business. So for all of you business owners out there, we're going to be shifting that financial risk from the insurance companies and taking it on ourselves. We feel like that's our responsibility. As far as overall quality, again, this, like I just said, it is phenomenal in this community, and we should be doing more to let the community understand just how good it is. Mm-hmm. But I would say that, Rob, that's pretty much it. I think our culture just allows us to do things very, very quickly, and we do almost everything with that vision in mind.